Is my guest on the programme today. John Johnson is vaccination and epidemic response advisor at MSF. He's set to actually travel to Congo tomorrow to help in the effort to control the disease. Thanks very much for being with us on the programme today. I mean, just tell us, I don't know if this is answerable, this question, but tell us how bad this could be.
Well, I think there's a lot of signs that this could be a very bad outbreak. The fact that it was discovered fairly late, because it's a different species of Ebola. It's not the more common Zaire species that we've seen in the West African outbreak or in the more recent outbreak in 2018, 2020 in the east of Congo. It's a virus called Bundibugyo that causes Ebola disease. They weren't necessarily testing for it originally, so the alert came very, very late after there were already about 50 deaths and a lot of suspects. One of the big problems we're having right now is the fact that they can't rapidly test all of the suspects because they don't have enough tests, and the tests are in Kinshasa, which are on the other side of the country. So the fact that we don't really understand the size of the outbreak and its geographic spread indicates that it could be very bad. The other factors that indicate this could be a bad outbreak are the fact that we do already see geographic spread to Uganda, to the city of Goma, which is many hours south in a different province. And it's an area that has been riddled by conflict since about 20 years. There's parts of the region that are not under government control, and the airports are more or less closed, which will hamper the response efforts.
Let's talk about what you were talking about there at the beginning, about the problem of the testing, because presumably that means then that they were testing people who did have this species of Ebola, but because they had this specific species, they were coming up negative.
Probably, yeah. So the first thing we look for is the classic Ebola Zaire. The most common after that is the Sudan virus, which is in the same family of Ebolas, and Bundibugyo. It's only caused 2 outbreaks in the past. It's not the first thing we think of, and so it was quite late for them.
So is there a problem in the testing, would you say?
Well, there's a problem in the availability of tests. I think that's just it, because you do have the tests, but they're in specialized centers like in Kinshasa. They're not available in places like Ituri or in the North Kivu, where they do have tests for Ebola Zaire.
So what, I mean, can we go as far as saying something's gone wrong in the process here?
Well, I think that the surveillance probably could have worked a lot better. And I think the alert came very late. The WHO was informed on May 5th. We know that there were already cases among healthcare workers back in April. The alert should have come much, much sooner, but because of the context, because of the conflict and the situation, we weren't necessarily seeing everything that was happening because a lot of those areas are not necessarily under good surveillance.
Now realising that there is a major problem, I mean, is everything being done as far as you can see from here to try and stamp it out, to try and contain it?
So the response really started on Friday. So we're not that far into the response, but the teams are being sent from WHO, from MSF, from different organizations to go help with the response. The Congolese authorities have a lot of experience managing Ebola outbreaks. This is their 17th Ebola outbreak. But the tools to put in place are going to take time. Having a good understanding of the epidemiology of this outbreak, the number of real suspect cases and its geographic spread, that's going to take a while. And today we're not there. We look at the case numbers and they go up significantly every single day, but we still only have a handful of positive tests. So we're looking at suspects who could be malaria, who could be dengue fever, but until we have more testing available and more people doing the surveillance and epidemiological work, we really won't know how big this epidemic is. And then the rest of the response is pretty classic. Case management, engagement with the community, coordination, and putting in place prevention and control for infections.
And would you say that the resources there that are needed to tackle it, I mean, both from organisations such as yourself, also from the government there as well, as you say?
No, I would say no. I mean, if we look at the health system in Congo, it's a very struggling health system. That's no surprise. It's a country that has a lot of challenges, both politically as well as in their socioeconomic situation, and their health system is a health system that struggles. We see that in the fact that this response was alerted so late, and they don't necessarily have the capacity internally to respond to everything themselves, but they know how to work with partners. At the same time, this area has had Ebola outbreaks in the past, so they have people that know how to treat Ebola. They have treatment centers for Ebola that can be rehabilitated and put back in action fairly quickly. So there's some upsides, but there's a lot of challenges working in Congo.
And what about the international response? I mean, has, for example, the cuts that the US has imposed in foreign aid, I mean, has that had any kind of impact here?
I'm sure it'll be easier to say once we look back and see what the impact is, but CDC American is very involved in surveillance. And so, it does really ask the question, how much was the fact that CDC and WHO don't have the same level of communication they had in the past, that WHO's lost a third of their workforce? How much of this financial aid cuts have really hampered the alert system that should have been there? And then going forward, looking at the response, there's no more USAID. And a lot of the actors that worked in response to Ebola outbreaks got their funding through USAID. So now we're going to have to look for different ways to support these actors.
What about you yourself? I know you're flying out tomorrow. Do you know what you're going to be doing?
I don't know yet. I mean, we're setting the response. My role is typically in coordination with the authorities and seeing how we can help. So I'm there to just basically negotiate what would you like us to do, and then talk with our teams and see what we're capable of doing.
So overall, when you see what's happened here, and as you say, the fact that this has happened numerous times before, it may be a different species of Ebola, but at the same time, people should be used to dealing with this kind of thing. It feels like we're getting it wrong. I mean, we've had an enormous, we've had other problems such as hantavirus, such as coronavirus, that have suddenly sprung up. It feels like more should be in place to ensure that this kind of thing can't happen. If it does happen, it's detected immediately.
Yeah, I mean, one of the things is about Ebola, it's something that we're never going to get rid of. It has an animal reservoir. It probably circulates in bats. That's the theory. And then there's a spillover event, and then it starts spreading among humans. So it's not something we could eradicate, because we'll never be able to get rid of the host population of bats that carry it. So it's not like we could eradicate Ebola. But at the same time, what we need to have in place is better surveillance and alert systems. So clearly that's the big challenge here. And then at the same time, we need to work on fixing the errors that we've had in the past. So making sure that there is not panic among the population. We saw that with hantavirus. We see that with any Ebola outbreak. And making sure that we gain the trust of the population and their engagement in the response at the beginning. Because in the past, what we've seen is it's not people coming from the outside that can stop an outbreak. It is the population themselves that will take control to reduce their risk, that will come to receive treatment, and that will come for being followed up as a suspect case or a contact of a case until we can slow the spread of the outbreak. And that's really the population themselves that can do that.
What about internationally? I mean, how worried should the rest of the world be as well? I mean, we've had an American doctor who's been infected, who's now been flown to Germany for treatment. We've got other people who've been affected. I gather the worst affected are being flown to other European countries. I mean, is there a risk of it spreading into the wider population?
Well, the WHO declared a public health emergency of international concern. That's their highest alert level. Certainly they think so. Ebola is not something that spreads easily. It's not highly contagious, but it's very, very lethal. And that's the big concern. I think it'll be easier to answer that once we know more about the size and the spread of this outbreak, because this is a population that is highly mobile. It's on the border with Uganda. It's on the border with South Sudan. There are airports in these countries. It's possible that people will leave and go to other countries, and we might see sporadic cases here and there. But in general, Ebola is not something that's going to cause a pandemic or a big outbreak in a place like France. But it's certainly a concern, and we might see more cases spread to different countries, absolutely.
Yeah, I mean, even the US has said in the last 24 hours, I think, that the football team from the Democratic Republic of Congo will be able to go to the World Cup, for example. I mean, presumably there'll be a lot of surveillance to ensure that there's no spread through, not just from the players, but from all the background team as well.
Yeah. Well, that's good. I'm glad to hear that.
Yeah, okay, well, there you go. I've told you something yourself that you didn't know. Good to have you with us on the programme today. Thanks very much for coming in and talking to us. Good luck with your trip as well.
Thank you.
It pays off. I'm sure it will. Thanks very much for being with us. John Johnson, he's vaccination and epidemic response advisor at MSF, off to Congo tomorrow to help the efforts there against Ebola. Thanks very much.
Thank you.